My name is Ray Lankin. I'm the founder of Diagnostic Services. UDS has been on the front end of early detection for firefighters since 2017. I started this company back in 2001 and have dedicated my life to diagnostic tests because I lost my mom to cancer when she was only 26 years old. Unfortunately, she was misdiagnosed. By the time physicians discovered cancer, it was already too late for her. So I started national mobilization of early detection programs in 2017. UDS stands as a fully accredited mobile diagnostic testing company, accommodating first responders in all 50 states and Canada. The inception of this program for firefighters started in New York City in the hospital networks where we operated. We started detecting cancer and cardiovascular disease at a very high rate. We looked at the occupation and realized we were working with firefighters who responded to 9/11. As you know, out of 20,000 men and women who responded to 9/11, over 3,000 developed different forms of cancer and cardiovascular disease in the last 20 years. For our medical team, that triggered extensive research. We looked at the gold standard diagnostic technology approved and promoted by the American Cancer Society that we could mobilize. We developed a very comprehensive program that consists of screening 9 organs and body parts. We scan across 4 different body systems, including a full cardiovascular evaluation. The diagnostic technology I'm referring to is ultrasound. Ultrasound quickly became the front line of early detection because it's one of the safest tools in radiology. It utilizes high-frequency sound waves to detect pathology, meaning there's no radiation, it's non-invasive, and it produces images in real time. This means that as we look at the organ, we can detect pathology during the test itself. Ultrasound is also very portable. By scanning 9 organs and body parts, we're able to detect 300+ different health conditions, focusing primarily on detecting cancer and cardiovascular disease early. Logistically, we set up on site. It's very easy to put this program together with the UDS team. We usually use about 300 square feet of open space and turn it into a complete diagnostic center that's safe and private for participants. The whole process takes about 30 minutes in and out of the facility. Just in the last 6 months, we've delivered this program to over 600 departments and locals like yours. These programs are very popular and work well to detect cancer and cardiovascular disease. Firefighters are at 9% greater risk of being diagnosed with cancer and 14% higher risk of dying from cancer once diagnosed. We evaluate the whole body to see which organs are susceptible to exposure. Firefighters pick up chemicals on the fire grounds when entering buildings with flame retardants, plastics, and synthetics, as well as exposure to diesel exhaust fumes and particles. All of these situations create cancer-causing risks. We also looked at organs affected by chronic overnight shifts and diminished immune function, along with behavioral risk factors such as excess weight, obesity, physical inactivity, cumulative stress, and PFAS chemicals. When you combine these occupational and behavioral health risks, it's clear why firefighters face greater risk of cancer and cardiovascular disease. So our job is to scan the entire body. In the endocrine system, we look at the thyroid. In the gastrointestinal system, the liver and gallbladder. In the urinary system, the kidneys and bladder. We check the prostate gland for enlargement. We also perform gender-specific scans, such as testicular scans for men and transabdominal pelvic scans for women. As mentioned, there is also a full cardiovascular evaluation embedded in the program. We look at the heart by performing echocardiograms, carotid arteries for inflammation or plaque buildup, the ascending aorta for dilation, and the abdominal aorta for aneurysm. That's 9 organs and body parts across 4 different body systems. What's important is how we report back from the screening to the individual. When we screen on site, all images are sent to state-licensed, board-certified radiologists and cardiologists for professional interpretation. Each participant receives 2 reports, one from a radiologist and one from a cardiologist, where both physicians underline any abnormalities in the conclusion section. Moreover, every abnormal report is coupled with a telemedicine consultation. Individuals can discuss their results with our medical professionals, learn about next steps, and reduce anxiety if the finding is not actionable. If a serious abnormality is flagged, We encourage immediate follow-up with their primary care physician. This is a HIPAA-compliant operation. Nobody outside the patient and medical team can access results. It takes about 5 to 10 business days for reports and phone calls to be completed. In the last 12-14 months, we've delivered services nationwide and detected over 100 cases of cancer at early stages. Every individual shown here was asymptomatic. Because we flagged their pathologies early, they had immediate biopsies or surgeries and are now in remission, back to light duty or full duty.
Very thankful for the scan that was offered. We want to be healthy and be there with our kids and watch them grow.
Early detection is the key to everything, to anything. And that's what this was. And every doctor that I went through said the same thing.
Just decided, talked with my wife, and opted to have the cancer screening process done. So thankfully, the union provided that opportunity for me.
They found some things to monitor, some things that I was unaware of, and had I not had the ultrasound, I would never have found out about. A certain lifestyle could probably never be a problem, but had I not known about it, it could have developed into a problem which ended up in open heart surgery.
Honestly, that's the biggest thing, is get there, get the scan done, if not for just peace of mind. For me, that's what it was going to be.
A journalist died at the World Cup, but what he passed away from, he didn't know he had, is what they found with the ultrasound in me, and they found it with that much time to spare.
Out of 10,000 firefighters tested, 64% had at least one actionable finding, which led us to detect over 2,000 high-risk pathologies across solid and hollow organs. We also prevented more than 705 heart attacks and strokes. Overall, these programs are extremely important. The success has been overwhelming because the statistics for firefighters are staggering. National reports show 70% of line-of-duty deaths since 2002 are due to cancer, and 18% due to cardiovascular disease. OSHA confirms firefighters face 12 to 19% greater cancer risk, specifically in organs like the thyroid, bladder, and testes. The World Health Organization classified occupational exposure as a firefighter as carcinogenic to humans Group 1, listing evidence and specific organs at risk. The IAFF has partnered with the American Cancer Society to study behavioral factors such as excess body weight, poor nutrition, inactivity, and alcohol consumption, which account for 1 in 5 cancer cases in the fire service. Cancer is rising across the general population as well. The American Cancer Society reported that in 2024, for the first time ever, the U.S. recorded over 2 million cancer diagnoses. That's about 5,500 new cases per day. And 70% of those cancers come from organs with no standard screening recommendations. Why am I saying this? Because the only weapon against cancer and cardiovascular disease for firefighters is aggressive early detection. If we can mobilize these gold standard diagnostic tools and detect pathologies early, the chance of survival goes up to 95% for most cancers, but that survival rate drops significantly if diagnosis comes at stage 4. In addition to its core diagnostic programs, United Diagnostic Services also provides several ancillary services that further support early detection and preventive care. CT scan services include low-dose chest (CT) for lung cancer screening, as well as coronary calcium scoring to help identify early plaque buildup in the coronary arteries and assess cardiovascular risk. Skin assessment is offered as part of UDS's cancer prevention and dermatology screening workflow. These evaluations are designed to identify suspicious skin lesions early, allowing for timely dermatologic follow-up when needed. Comprehensive blood panel testing goes beyond traditional lab work. In addition to standard markers, UDS includes advanced cardiovascular and inflammatory biomarkers such as ApoB and lipoprotein A, helping to identify hidden risk factors that may not appear in routine testing. The GRAIL Multi-Cancer Early Detection Blood Test. Multi-Cancer Early Detection Blood Test is available as an optional add-on for departments. This advanced liquid biopsy analyzes signals associated with more than 30 types of cancer and is designed to complement existing screening and early detection programs. UDS also offers a comprehensive physician-based wellness programs with full clinical oversight. All diagnostic testing, including stress tests, is interpreted by board-certified cardiologists, and evaluations are reviewed by state-licensed physicians. We also provide advanced diagnostics such as stress echo, VO2 max testing, and advanced lipid panels to support a complete and accurate health assessment. Thank you for sitting through our presentation. We appreciate it. For more information, scan the QR code.